More than 1 million Ohioans have filed for unemployment in the last 2 months, and nearly 17% of them were out of work last month.
On top of losing their jobs, many have also lost their health insurance if it was provided through work. Finding new coverage in the middle of a global pandemic, it might not be easy. It's not going to be cheap.
News 5's Kevin Barry explains how you can still make sure your health insurance as Northeast Ohio looks to rebound.
In early March, right before social distancing measures came to Ohio, Kyle Stroh started a job at a staffing company helping other people find new positions. It was terrible timing.
It was definitely nerve-wracking.
Coronavirus was about to shut down the state, leading to record unemployment. As one of the most recent people hired, Kyle was one of the first to be let go, with health insurance only until the end of April.
It was scary being able to, or knowing that I might not have insurance coverage for a little bit.
J.B. Silvers at Case Western Reserve University says cases like Kyle's are common because in the United States, health insurance is often closely tied to our employment.
Which works fine as long as you have a job, but when you don't have a job, it creates a real problem.
JB says the best option for what to do next depends on your situation. First, he says talk to your human resources department and see how long coverage can be extended for. Second, most people will qualify for coverage under the Affordable Care Act because losing your job allows you to sign up at any point in the year.
For lower income people, that's almost certainly the best way to go. But you have to make that election within 60 days of the event. So if you don't do that, you're out of luck.
The last option is COBRA. It allows you to keep the same coverage you had through your employer normally for up to a year and a half. The catch is you're on the hook for what you contributed when you were working and what your employer was paying too.
So suddenly your premiums might go up by a factor of 3 or 4.
Kyle chose a fourth option.
And kind of motivated me to really try to find a job as soon as possible.
It might not work for everybody, especially because leaving the house isn't recommended for people at high risk for the coronavirus. But it worked for Kyle.
Having to pay kind of an arm and a leg for COBRA, I knew that was always an option, but obviously I didn't want to pay as much if I could find a good company that provided benefits as well.
A few days before Kyle's health coverage would have expired, he started a new position with new coverage. In Cleveland, I'm Kevin Barry, News 5.